Autism is a bit difficult to explain completely in a small definition, but basically the main problems that we have in autism are: number one, they have speech and language delay, both in expression and receptive language. Number two, they have problems with social interaction and communication. And number three, the main other thing is their behavior. They are very self-centered. They are not able to think about the need of others. As a result, they will keep on doing the same thing that they would like repeatedly. So they would like keep on spinning, get very irritated if there is anything that is being demanded of them by others. So it's not a simple definition. If you have these three things together, then one should start to worry whether my child has got some developmental problem. It's not a neurological condition that you have a problem with the structure of the brain. It is mainly a developmental problem, which we start to see at fairly young age, by around 1 to 2 years of age. And when parents get concerned that there is a problem with speech, that's first thing that gets their attention, and they should bring the child to the doctor for a detailed assessment and review. Again, the causes are not simple, like one infection or one thing. It's a combination of genetic and environmental factors. So they are definitely depends upon where you work, but in advanced centers, especially if you are abroad, then you can get detailed genetic investigations done. So about 10% of children who have got autistic spectrum disorder, they might have a genetic predisposition to autism. And otherwise, in 90% of the children, there isn't any specific genetic disorder. If a child has got functional difficulties, then you have to focus on autism and get the autism assessment done. In terms of environmental factors, things that we have commonly started to see in nuclear families, both parents are working. They are just not getting enough time to interact and play with children. As a result, children are spending a lot of time on mobile, on television. And again, the way the brain functions, if you are using too much screen time on mobile or television, then you start to just keep on following a certain route. So the car is going round and round, and your attention is flicking from one side to the other, and it just keeps on going. Or there's a gun booming around, and basically your attention is just focused on the gun going. So these are other environmental factors. Some parents, basically there is limited family members, they are not playing, sitting down and interacting. So these help in a child who has got autistic tendencies to show full autistic spectrum problems. So the general symptoms that we first start to notice also depends upon the age. So at between 12 to 14, 16 months, child should start to make certain sort of vocalizations, noises, papa, dada, mama, and often we would see a significant delay in that. By 2 years of age, they should start to put two words together. So again, they are usually late in that. They'll keep on repeating a phrase again and again without really understanding the meaning of that. So somebody tells them 1, 2, 3, 4, and they'll just 1, 2, 3, 4. They'll just wrote it out, but they are not able to understand the meaning. So that's the first major thing in terms of symptoms: speech and language delay, which is both in terms of expressive as well as receptive. They are not able to follow simple instructions. if we are able to catch this, then the child can be brought early. The other important symptoms that we see is they are not able to interact and socially communicate. So their eye contact is poor. Basically, they'll just keep on doing things that they like and busy with themselves rather than responding to the reciprocal conversation which should be going on with the family. And as a result, if they are not able to communicate properly, then they get into certain routines. They'll keep on basically either playing just on their own, have a car and turning the wheels repeatedly, or keep on opening the tap and see how the water is flowing down. So these three things together, the speech language delay, poor social interaction and communication, and getting into a behavior pattern where they are playing on their own or isolated, so not a constructive play, and as a result sometimes they can become sort of really unhappy and irritated if somebody asks them to do certain things. So autism, basically we have to understand that there is no curative treatment, because it's not a simple condition where you have an infection and you can treat it. But it has to be managed well by therapy and with advice from doctors. Medicine as such doesn't have much role, but if there are certain complications or problems, your doctor may prescribe some medicines for later on. So we should mainly think in terms of that this is a developmental disorder. We have to help the child with therapy and also make family members involved with this so that they can regularly do these things at home as well. So, we are not looking for a cure, and it's a kind of, main therapy is occupational therapy, speech therapy, to help the child get interested in their environment, in other people, and then you give them speech therapy so that they can carry out a reciprocal conversation. In terms of other problems, basically sometimes these children can be very hyperactive, and if that is a problem, then yes, the doctors may use medicines like methylphenidate, or sometimes there are other medicines as well. If the child is really distressed and not really at all settling down, then at times medicines like risperidone have been used as well. But one has to be very careful with using risperidone because there are significant side effects. In terms of therapy, there are again lots of different schools of therapy. So one is basically ABA therapy, which is the most commonly used augmentative behavioral therapy, where the therapist works along with the child and the family to change their behavior. The really important thing which makes a big difference is if the condition is brought up early and the child is seen and the therapy is started early, then the prognosis is much better, because it is easier to change the behavior of a child early on rather than later on when the behavior has become quite firm.